Managing type 2 diabetes can feel like a constant guessing game. Well, what if you could see exactly how your body responds to every meal, every snack, every poor night of sleep, or workout in real time? That's where a continuous glucose monitor, or CGM, comes in. In the next 5 minutes, I'll explain how a CGM works and why it's a game changer for men looking to boost their energy, ultimately reverse type 2 diabetes. I'll also touch on the Hawthorne effect, which is a powerful tool that most guys aren't leveraging. I'm Dr. Adam. I am a naturopathic doctor and men's diabetes coach. Today, I'll introduce you to one of the most effective tools that I found for managing blood sugar and reversing type 2 diabetes, and that's the continuous glucose monitor. So what is a CGM? A CGM is a small device that you wear on the back of your arm that tracks your blood sugar levels 24/7. It consists of two main parts. It has a sensor. This measures your glucose every few minutes. And then the transmitter, which sends that data to a phone app or a reader. And the data includes real-time glucose levels. It also has a graph of daily trends and even a daily average, and all of which are invaluable for tracking your progress. If your blood sugar gets too high or too low, you'll also get an alert. So if you're used to finger sticks, you're probably checking your glucose 3 to 5 times a day max, where a CGM, by comparison, collects over 200 data points daily, giving you a much clearer picture of your blood sugar patterns. It's not painful, it's not bulky or invasive, plus it's affordable. Just a few years ago, CGMs cost nearly $1,000 out of pocket, but now they're as low as $100 for 4 weeks, even without a prescription. So here's 4 reasons every man with type 2 diabetes should use a CGM. Reason number 1 is the Hawthorne effect. When we know we're being observed, we change our behavior. This is the Hawthorne effect, and it's why having a diabetes coach is often more effective than just seeing your doctor every few months. Because many guys cheat on their diet, conveniently avoid checking their blood sugar afterward. But with a CGM, you can't avoid the data. It's always tracking. So for me, using a CGM, even as someone without diabetes, this process made me more mindful of what I was eating, what it was doing to my blood sugar levels. And the result was more energy, which is awesome. Okay, reason number 2 is immediate feedback. So a CGM shows you in real time how food, exercise, sleep, and stress affect your blood sugar. Most doctors focus on diet alone, but the reality is that factors like poor sleep or high stress can be just as impactful. The CGM helps you connect the dots between your lifestyle and your blood sugar so you can make adjustments on the fly. Reason number 3 is faster results. So frequent tracking allows you to quickly see what's working and what's not. So instead of waiting 3 months for your next doctor's visit, you can fine-tune your approach on a daily basis. And this obviously leads to faster progress with your diet and exercise and overall lifestyle. Reason number 4 is spotting blood sugar spikes and crashes. So most people with type 2 diabetes are told to check their blood sugar before and after they eat, maybe in the morning too. But if you stick with this consistently, whereas a CGM tracks everything automatically so you won't miss critical spikes or dips. It also lets you experiment and identify patterns without needing to prick your finger dozens of times, which is pretty nice. So how to get started with a CGM: talk to your doctor. Many primary care physicians and endocrinologists can prescribe a CGM, and your insurance will cover it. Over-the-counter options also exist. Companies like NutriSense and Stello offer CGMs without a prescription. And if you're paying out of pocket, CGMs are now affordable. It's as low as $100 for 4 weeks. So a CGM gives you control over your type 2 diabetes instead of letting it control you. Finger sticks work, but they're outdated. A CGM is a modern, more effective approach to managing your metabolic health. And what I've noticed is that guys who are content with managing their diabetes track as little as possible, whereas the guys who are motivated to reverse diabetes want more data, more insight, so they can make faster adjustments. And a CGM lets you do exactly that. So if you're serious about fixing your blood sugar management, start exploring CGM's options today. Let me know in the comments if this was helpful. Feel free to like this video and subscribe for more information on reversing type 2 diabetes. Take care.